Let's cross live to Venezuela and speak to Karol Bassim from the International Medical Corps Emergency Response Unit. Karol, welcome to the programme. Thank you very much for being here. Can you just describe the situation where you are right now, please?
Yeah, hi. Yeah, the scale of the needs and the destruction makes this one of the most difficult emergencies to operate. The situation on the ground remains severely complex. Infrastructure has been severely damaged, and people are still suffering. People are still trying to look for their beloved ones, and the health facilities the affected areas are quite overwhelmed. So even though days has passed, unfortunately, the situation remains quite critical.
This is a country which not only has suffered with the earthquake and the natural disaster, but also was suffering economically and politically. The infrastructure was also far from perfect, wasn't it? So it seems that there are lots of extra additional issues that you and the Venezuelans are having to deal with.
That's correct. I mean, the communities are going through a lot of pain, and when you have a weak health system, and currently the health system in many affected areas has effectively collapsed, and even the facilities in non-affected areas are under intense pressure due to the influx of the patients. We have International Medical Corps conducted an assessment within 24 hours of the earthquake, and to understand the most urgent medical needs. And we've met with community leaders, we've met with local authorities, we've met with hospital directors, and based on what we learn, our teams are now reaching the affected communities by working directly with hospitals that are overwhelmed. There's a lot of needs. Access is challenging, but we're getting where we need to be.
You have worked in multiple disaster zones on a personal level, on a professional level. How does this compare to what you've seen before?
This is massive. And everyone is trying to work around the clock. This is not easy. People are suffering, and now we see more healthcare workers, patients, families who are going through a lot of anxieties, a lot of post-traumatic stress. So that's clearly shows that there's there's a need on mental health and psychosocial support.
We have spoken and mentioned that the thousands, possibly, well, the tens of thousands of people who are still missing right now. Karol, how do you prepare for the worst case scenario? Because presumably, with all the support and all the medical teams there, that still wouldn't be enough to deal with a death toll that possibly could be that high.
But I mean, a lot of people are trying to support. In addition to humanitarian organizations, you have the civil society, you have the health authorities, you have the community-led collection points that have been established in different areas, and people are trying to support each other. So many individuals are also directly supporting rescue efforts, demonstrating strong solidarity and community mobilization across the country. From our end, International Medical Corps, we're going to support those overwhelmed hospitals. We're going to reach out to the affected communities, remote communities, and provide them with medical services. And we're going to work to ensure water and hygiene conditions do not deteriorate. So, yeah, I mean, we're going to take it day by day and do our best to provide all the life-saving services.
There is the international community are now trying to help. There is increases in financial support being offered from the likes of America and Britain. How important is it that there is solid international assistance right now?
It's very important because it allows, it helps with the access. It helps with providing the necessary support. It breaks down all the challenges in terms of, logistical challenges or challenges in reaching out to hard communities. With all of those support and resources, it makes aid reach quicker. So.
And I know you don't talk about the political side of things, but the government has said there's more than 25,000 emergency workers and police and soldiers which are now being deployed. Will you actively work with those? Are you able to work with those government officials on the ground? Will that help?
We are working directly with the health facilities, with the affected hospitals, with the affected communities. We're sending our medical mobile units to provide all the necessary medical support. So we continue to collaborate with the Ministry of Health and work directly with the health facilities and affected communities.
Right. And finally, Karol, what happens next? Because obviously you are trying to deal with the people who are pulled out of the rubble and caught up in the rubble, but presumably your concerns are the disease that may spread in the wake of this. How are you hoping to manage that?
International Medical Corps have two large field hospitals pre-positioned, one in Panama and one in Memphis, and we plan to deploy in those fields very soon. So we are working very closely with the Ministry of Health to strengthen the response.
Okay. Karol, thank you very much for your time. Good luck. I can only imagine how difficult things are out there right now. Thanks for taking some time to speak to us. Take care. That is Karol Bassim there from the International Medical Corps Emergency Response Unit, live from Venezuela.